Hello everyone, it's good to be with you again. It's been about 6 weeks since my last update, and as you'll recall, the last update closed out my 180-day plan. I told you that I'd be giving you another update in the first quarter of fiscal year 18, so here we are today. Let me start by saying a happy holiday season to all of you. Really this time of year gives us all an opportunity to remind ourselves about the things that we have to be thankful for, friends, family, our careers, the opportunity to take care of those that we love. But I'm also thankful for the great things that we have happening in the Central Texas Veterans Healthcare System, and I want to talk to you about some of them today. We've talked previously about some of our modernization activities. I'll give you updates on those. We've talked about what we're doing as an organization to improve the veteran and employee experience. So I'll give you a few updates on some things that we've done during the first quarter there. And I'm also going to share with you some good news stories, because we have plenty of them to share just in the first quarter about what's happening in our healthcare system. So we'll get started. So first we'll talk about modernization in our healthcare system. In October 15th to be precise, we opened our first female psychiatric unit on our Waco campus. I'm really proud of our mental health service, our engineering department, nursing service, our activations committee, and the others that have been involved in that project. Some of you may be aware we have historically had a diversion status for psychiatric beds, specifically female psychiatric beds, and made a decision that our female patients were going to receive the same level of care as our male veterans. Within 4 months of making the decision to open that unit, our engineering staff, nursing leadership, and others pulled together, put together a plan, operationalized it. Engineering constructed that unit, and the unit was opened on October 15th. So I'm really proud of that inpatient unit, and I would encourage staff, as you have the opportunity, to go up and take a look at it. For our staff here at the Temple campus, you're continuing to see the first floor of Building 163 transform into a new organization as our engineering staff and others proceed with our halls and walls projects, replacing some of the flooring, putting new facelifts on the facility, putting in new furniture. They're also making considerable progress on our outpatient laboratory area. Again, I would encourage staff, if you have not seen what our engineering department has been able to accomplish with our internal construction team, I really would ask that you come down and take a look at it. It really is beautiful. We also have a new call center that's nearing completion. This call center is going to replace the interim one that we constructed for medical administration service. The new call center will be located in Building 171, and we're getting very close to opening that call center, and Amy Maynard in engineering will give you updates likely in the next video about exactly when that call center will open, but we're getting very close to doing so. Under modernization, I also want to talk to you about new sites of care. We've got really 3 new sites of care, 2 actual, 1 virtual, that I really want to share with you today because we've been excited about the progress that we've made. So I'll start with LaGrange. Many of you know, especially if you come through new employee orientation with me or others on the senior leadership team, and we've talked to you about our 10 sites of care and mentioned our LaGrange outpatient clinic that has historically been a contract site of care. Meaning we had a contractor, in this particular instance the company has been named Sterling. They've run the LaGrange outpatient clinic since 2009. After a town hall that I had with veterans in the LaGrange area in April, we made a conscious decision that we were going to convert that contract location into a VA staff site with the attempt at partnering with the community and expanding the services that we provide our patients in LaGrange. I'm excited to share with you today that we've done something that I think is going to be the model for VA, and many have already called me and are asking how we were able to accomplish it, and we'll be watching this in the future. In short, we partnered with the local hospital there, St. Mark's Medical Center, into a very unique partnership that allowed us to procure space from them at a very reasonable and below market cost. We are actively building out that space, and as a result we're going to not just keep our LaGrange site open, but we're going to be expanding the services that are available for those patients, including on-site mental health services that have not been available before. And we're doing all of this at the same, if not lower cost than it costs the American taxpayer to pay for our contract location. We've also done this in record time. It can take years in some cases to lease a new building, but because we use a new vehicle called the licensing agreement, we expect to go from decision to opening that new site in less than 6 months. So we'll give you more updates as we get closer to opening that clinic, but for now we expect to have the LaGrange CBOC open between February and March of 2018. I really want to give a special thanks to our activation committee, to ambulatory care, and to Robert Farias, my executive assistant, who's had a big role in moving that project along. So more to come on LaGrange. So next we'll talk about Cedar Park. Many of you may know that our current Cedar Park location opened just a year ago. But because we are one of the fastest growing healthcare systems in VA in terms of percent of overall growth, that clinic was already too small. In discussion with our network director and others, we've already identified a new location for Cedar Park that's going to take that building from that current clinic from about 10,000 square feet to nearly 25,000 square feet and give us plenty of extra space and time to grow into that new location. We also are planning to have that clinic, similar to LaGrange, co-located in the medical community so that we can partner more with private providers in the case that we do have to send a veteran to the community to keep that care close to home and with partners that we can work with and get familiar with. So again, very excited about that. We do expect to have the actual contract for Cedar Park awarded before the end of the fiscal year. And again, I'll keep you updated as the contract is actually awarded and we're preparing to begin the build out. So our third new site of care is a unique one. It's a virtual site of care. In October, Central Texas was approved to activate the first telehealth primary care hub for Vision 17. In essence, this means we're going to be providing virtual primary care services for other sites in our VISN. This includes healthcare systems like Big Spring, El Paso, and Valley Coastal Bend. We've had a number of consultants come in and work with us, and I'm proud to let you know that we've already activated our primary care hub, and as of today have seen over 120 patients for the Big Spring healthcare system, and we expect to have Valley Coastal Bend, their Corpus Christi site, online by January. Next will be El Paso, and we're actively looking at staffing out a primary care team for our Temple campus as well. So this is a brand new initiative for Central Texas. I'm very excited about it and believe that this is the future of healthcare, and it's nice to know that we're in a position of leading it in our vision. So what I'll share with you next are just a couple good news stories. We have plenty, and I just don't have the time to share them all with you today. But a couple that I do think are worth sharing with you so that you can take the same pride in them that I do. Around October 4th, I got a very nice email from Carolyn Clancy. Dr. Clancy is the Acting Undersecretary for Health for VHA, the Veterans Health Administration. And in synopsis, the message I got from Dr. Clancy indicated that Central Texas is one of the most improved facilities in the country in SAIL, which stands for the Strategic Analytics for Improvement in Learning. This is one of the quality indicators that VA uses to identify if we're providing high quality care to our patients. And she acknowledged that in 2017, the Central Texas Veterans Healthcare System was one of the most improved across the country, and saw the transition that we've made from a 1-star to a high 3-star, and just made very clear that that type of improvement doesn't just happen, that it requires not just leadership, but staff that are working diligently, and that she was very, very proud to see the improvements that we've made. So as a result, we've had others reach out to us across VA asking how we've made the improvement, and we do intend to help our peers to ensure that across the country we're providing the level of care that our veterans deserve. In addition to that, we had the opportunity to have an article published in the VHA modernization blog because of some of the activity we have ongoing, like the Primary Care Hub I just talked to you about, the LaGrange CBOC that I shared with you, but including other things that we've done recently, like activate the VA Video Connect, the new app that allows veterans to virtually talk to the healthcare providers. The fact that we deployed that in our call center, and now giving nurses the opportunity to have virtual dialogue face-to-face with our patients. So if you haven't had a chance to read that article, I would encourage you to take a look at it. Deb Meyer, our public affairs officer, did email out the link to you, so please go in and take a look at it, because everything there would not have happened if it wasn't for your efforts. We also had an opportunity to be recognized in the Secretary, Dr. Shulkin, the Secretary of the VA, in his Twitter feed. In early December, I had the opportunity to go to Washington, D.C. and meet with Congressman John Carter. Congressman Carter and I had great discussion, talked about Central Texas, shared with him the improvements that we've made, and we covered a few other topics, and the meeting ended very well. It was a really strong partnership. So Congressman Carter posted some information about our meeting on his Twitter feed that the Secretary of the VA picked up and retweeted. So again, giving us a lot of really positive publicity. I also want to congratulate both nursing service and social work. They have been recognized as a national leader in first VHA, and now in healthcare in general for their implementation of our integrated case management program. I'm really honored that at the end of January, between January 24th and 26th, I'll be going to Atlanta, Georgia with Brian Sisk, our Associate Director for Patient Care Services, Dorothy Sanders, and Rachel Masidi, and we're going to be presenting at the World Health Congress. This is a private organization. Healthcare systems from across the country come in to learn about what their peers are doing to improve the care that we're providing to the U.S. population. And because of the abstract that Dorothy and Rachel submitted, they've asked our team to come in and give upwards of a 2-hour presentation on what we've done with integrated case management and how it's improved both our care coordination and our relationships with our veterans. So look forward to that, and I'm sure we'll share it with you after we come back from the presentation. So now we'll talk a little bit about what we're doing to improve the employee and veteran experience. Again, many of you will remember when I came in back in February, I said we were really going to use the all-employee survey, which obviously is a survey that you complete, to make sure that we're doing everything we can to improve your experience as an employee here at Central Texas. We did recently receive the 2017 all-employee survey results. We've had a number of training sessions. I hope you've had the opportunity to participate in those. They've been led by Monica Smith in our Patient Experience Office. I think a quick takeaway that I want to share with you is that in the all-employee survey this year, we had for the first time the opportunity to hear from our staff what they thought the top 3 priorities for our healthcare system needed to be. This year, what you told us the top priorities need to be were accountability, which I was really happy to see because it told me that it was consistent information that came out of my transition briefings. So we had accountability, we had growth, which meant you wanted us to create better opportunities for your individual growth in your roles. And last but not least was recognition, which was defined as recognizing performance fairly and in a meaningful way. So we will continue to partner with you to address these areas. I would encourage you as employees to be certain that you're aware of your individual work group and service all-employer survey results. That was the intent of the briefings that Ms. Smith has had open to all employees, but also feel comfortable talking to your supervisor, engaging them in the all-employee survey results with the expectation that you can work with them collaboratively to ensure that we're improving your work environment. In February, I have readiness briefings with all of the services, and they will be giving me updates on what they're doing with those all-employee survey results to improve your experience. So now we'll talk a little bit about improving the veteran experience. We are still getting SHEP surveys in. I've gotten a number of emails from patients directly, speak to the directors from patients that are telling me that they're seeing the cultural change in our organization, and they're seeing it with you. From messages I've received from them about smiling faces when they walk in the door, people actually answering the phones when they call, and just feeling like we are part of their family. So our patients are seeing it and they're letting me know it. But we're also reaching out to them in other ways to ensure that we are doing everything we can to improve their experience. We had our first veteran forum at our Waco campus on December 12th. This was a collection of staff and several veterans. In this particular case, it was a Army veteran by the name of Jeff and an Air Force veteran by the name of Jennifer. They came in to talk to us about their experiences at the Waco campus. We had great interaction between the veterans and our staff to give us some insight into what we could do at the Waco campus in particular to improve their experience. We are going to continue to do those veteran forums, as I promised you before, and look for those invites from Public Affairs and from our Patient Experience Office as we prepare to do other sessions both in Temple and in Austin. As I get to the end of the update today, I want to reflect on a comment I made to you at the beginning of the video when I said, happy holidays to you, and talked about the things that we have to be thankful for. Many of you know that one of the Secretary's top 5 priorities is suicide prevention. But what we don't always connect are things like suicide prevention and the holidays. So understand that while many of us have a lot to be thankful for during this holiday season, that for some of our veterans, the holidays can be a sad time. They may not have families or friends to celebrate the holidays with, and in some cases, they could have failing health. I want us to be mindful and aware of this so that when our veterans come into our organizations, we can make sure that we're greeting them with a smile and let them know how much we care about them and how much we love them. So with that, I want to say thank you. I want to say thank you for what you do every day at Central Texas. I want to say thank you for choosing Central Texas. I want to wish you a happy holiday season and a happy new year. Thank you.